In this morning's Health Watch, the new line on wrinkles. Doctors traditionally evaluate whether a patient looks older than his or her age, thinking that could be a sign of poor health. But Dr. Jennifer Ashton is here with some new research that may take that widely held belief into question. So this is actually part of a routine checkup. You look at the physical appearance and see, does it match the number that you have on your chart?
Yep, absolutely. And this actually, Erica, brought me back to medical school, because in the formal training of medicine and the practice of medicine, this is in fact one of the first things we are taught in medical school about how to assess and evaluate a patient. So we usually know the patient's age when we meet him or her, but when we actually look at them and we see how they look, it should be an instinctive reaction. Does the person look older than their stated age, younger than their stated age, or their stated age?
Or just right.
Exactly, just perfect. And the thinking, as you mentioned, is that if someone looks dramatically older than their stated age, maybe they're not just looking older on the outside, but they're also looking older on the inside.
And so one thing that obviously makes people look older are wrinkles. So this study took all of that into question, looked at people, looked at their physical appearance, looked at the wrinkles, and they actually found some correlation.
And it was a little surprising. The study was done in Canada. They looked at 126 patients and then asked 50 doctors and residents to assess their age and their appearance. And they actually found that someone has to look 10 or more years older than their stated age to have the corresponding negative health implications that go along with that. So it might not always be the most accurate. And guess what? If you look younger than your stated age, doesn't mean you're necessarily healthier on the inside.
Like that whole thing, you could be skinny, but it doesn't mean you're
Correct.
healthy.
Correct.
So then what do we do? Because people are obviously worried about wrinkles, and you hear this, and if you see some prematurely, you might be a little bit worried about them.
So when you talk about wrinkling and premature aging, it's a little different than wrinkling and the normal aging process. As we age, the skin, just like every other part of our body, goes through an aging process. And when you're talking about the skin, it loses collagen, it loses elastin, it loses its cell kind of integrity, which keeps the moisture in and keeps the firmness there. And what we see on face value, pardon the pun, are wrinkles. So again, normal part of aging. If it happens too early, then of course there are things that you can try to do.
And what are some ways to cut back on when those wrinkles start to appear? I'm guessing the sun is probably one of the biggest factors.
The sun is the biggest one that we can control. What we can't control is our genetics. So you want to look at your parents and either thank them or not, in terms
or have
of
a talk with them.
Exactly, in terms of how they look. But sun exposure is huge for wrinkling and the aging process. The other thing, obviously, is smoking. It's a huge environmental assault on our skin. Actually affects the blood vessels in our skin, leads to extreme aging. Diet is huge. I mean, there have been whole books written about the positive impacts on diet and how your skin looks. And lastly, moisturize. You want to moisturize from the inside in the term of hydration and water, as well as topically with lotions. All those things can help.
They all help. And of course, if you're concerned about anything, consult your doctor.
Yeah,
as we do with our doctor.
20.
And I didn't even pay you to say that this morning. Jen, thanks.